पांचों कटे पुपुना is very vital. Yes.
सर जो आखिर में बचेगा वो करेगा.
Yes. The last person will perform. So. Okay, बच्चे start.
मैं क्या मैं इधर खड़ा तो चारों गया कौन सा
फोन तो पका भी तो सही है.
presentation.
आप दोनों कर रहे हैं. ये भी किया.
बच्चे कम.
My name is Dr. Zarnab. I am the final year of medical school. I am your doctor. I am here to examine you. I hope you will cooperate with me. So, ma'am, what's your good name?
Abeer Fatima,
Ma'am, what's your age?
22.
Ma'am, what thing has brought you here? How can I help you?
I am suffering from cough.
Okay, ma'am. Any others?
No,
Okay, ma'am. So, ma'am, tell me about how long you're suffering from the cough.
from last 3 days.
Okay, so I'm asking about the duration of the cough because we have the cough which we have from the last 3 days, which means it has an acute cough. If it persists more than the 8 weeks, then it will go to the chronic one. So, ma'am, can you please tell me about how long your cough get worsened in day or at night?
Not any specific time.
Okay, thank you. I'm asking this to my patient because if we have a cough in the morning, it will associate with the specific disease, which may be the chronic bronchitis, or maybe if the ma'am have the cough at the night, it will associate with the asthma or some other disease due to the pulmonary edema. Ma'am, can you please tell me about the any aggregating or precipitating factor that will lead to cough?
I didn't feel anything which aggravated or
Ma'am,
which relieved it.
Ma'am, can you please tell me when you go outside anything or you will come in contact with specific things you feel your cough worsen?
No, nothing.
So I'm asking this because there is some allergic reactions which will lead to the asthma. Ma'am, can you please tell me about the character of your cough? Is your cough croaky, harsh, or barking like?
It is more like barking cough.
Okay, so I'm asking this because in croaky cough is associated with a specific disease, which is bacterial acute infection. Harsh is associated with asthma and viral infections, and barking like cough is associated with pertussis and pneumonia. Ma'am, can you please tell me about your cough? Is you feel any dryness in your cough, or your cough is productive type? Do you feel a sputum in your cough?
Yes, a little bit of sputum.
So, ma'am, can you please tell me how much amount of the sputum do you feel?
Not a lot, just a little sputum.
Okay, so ma'am, can you please tell me about the color and odor of the sputum?
It is green and foul smelling.
Okay. So I'm asking this to my patient because if a productive cough amount produced, there is association with a specific disease, which will be the asthma, pneumonia, or bronchiectasis. The color of the cough If there is a blood, it will lead to the pneumonia or the cancer. If there is a purulent, there is some bacterial infection. If it's a clear, there is a viral or some allergic reaction. Ma'am, can you please tell me, is your cough increase or decrease when you change in your posture?
No, I didn't feel anything.
So there is some association diseases of the respiratory system which are associated with the postural variations such as lung abscess and bronchiectasis. That's why I'm asking this about the posture to my patient. So ma'am, can you feel any association symptoms with your cough? The shortness of breath or difficulty in breathing?
A little bit shortness of breath.
Okay. So ma'am, can you feel any change in your weight?
No,
Do you feel any heaviness on your chest?
no.
Okay ma'am. So I'm going to ask you some personal questions. Can you allow me?
Yes, please.
Do you smoke?
No,
Do you use any kind of other medications?
no.
So ma'am, can you tell me if anyone in your family has the past history of respiratory disease or cardiac disease?
No,
Can you use any medication?
no. I don't use any medication.
So I'm asking about the patient about the medication because there is some specific medicine which will lead to the dry cough such as AC inhibitors or beta blocker which will lead to the bronchospasms. It will lead to the mimic of asthma. Ma'am, can you please tell me, is your cough get worsened after eating or drinking?
No,
I'm asking this about my patient because in gastroesophageal reflux disease, our cough get worsened after drinking and eating. Can you please tell me about your occupation?
I'm a student.
Ma'am, can you please tell me, have you traveled before?
No, I haven't traveled.
I'm asking about the travel history and occupational history to the patient because there is some specific disease which are associated with the specific countries such as TB, which are very common in India or South Asian countries. And about the occupational histories, in former we are seeing the asbestos cough. That's why I'm asking this to my patient. So I'm done with the history taking of my patient. The summary of my patient is my patient name is Dr. Abeer. My patient name is Abeer Fatma, which is 22 years old female. He is student and he is the chief complaint of the cough. The history of present complaint coughing for the last 3 days. Her vitals are normal, but he has persistent cough. No specific timing. Barking in nature. Productive cough consists of sputum. No dark history, no special history, and no family history. She has a dry cough. She feels difficulty in breathing. She has sputum. Shortness of breath. So my differential diagnosis is pneumonia, bronchiectasis, lung abscess, or respiratory tract infection. Further, I have run some tests to confirm the diagnosis. I will run chest X-ray, culture sensitivity test of blood and sputum, complete blood count. The medications I will give to my patient after the result of culture and sensitivity test. I will give the patient to the antibiotics because it is the case of the pneumonia.